What is rubella? Rubella is a contagious disease that mostly affects children. It causes symptoms like a rash, fever, and eye redness. It's usually mild in kids, but it can be serious in pregnant women. You may also hear rubella called the German measles or the 3-day measles. The best way to protect yourself and your children from infection is to get vaccinated with the measles, mumps, and rubella, MMR, vaccine. Before the rubella vaccine, epidemics happened every 6 to 9 years, usually among kids 5 to 9 years old, along with many cases of congenital rubella. Pregnancy and rubella. Rubella is very dangerous for a pregnant woman and her developing baby. Anyone who is not vaccinated against rubella is at risk of getting the disease. Although rubella was declared eliminated from the US in 2004, cases can occur when unvaccinated people are exposed to infected people, mostly through international travel. Women should make sure they are protected from rubella before they get pregnant. Infection with rubella virus causes the most severe damage when the mother is infected early in pregnancy, especially in the first 12 weeks, first trimester. During 2005 to 2018, 15 babies with CRS have been reported in the United States. Congenital rubella syndrome, CRS. Congenital rubella syndrome, CRS, is a condition that occurs in a developing baby in the womb whose mother is infected with the rubella virus. Pregnant women who contract rubella are at risk for miscarriage or stillbirth. Further, their developing babies are at risk for severe birth defects with devastating, lifelong consequences. CRS can affect almost everything in the developing baby's body. The most common birth defects from CRS can include deafness, cataracts, heart defects, intellectual disabilities, liver and spleen damage, low birth weight, skin rash at birth. Less common complications from CRS can include glaucoma, brain damage, thyroid and other hormone problems, inflammation of the lungs. Although specific symptoms can be treated, there is no cure for CRS. Since there is no cure, it is important for women to get vaccinated before they get pregnant. What are the signs and symptoms of rubella? Rubella infection may begin with 1 to 2 days of mild fever, 99 degrees to 100 degrees Fahrenheit, 37.2 degrees minus 37.8 degrees Celsius, and swollen, tender lymph nodes, usually in the back of the neck or behind the ears. A rash then begins on the face and spreads downward. As it spreads, it usually clears on the face. The rubella rash is often the first sign of illness that a parent notices. Viral rashes. It can look like many other viral rashes, appearing as either pink or light red spots, which may merge to form evenly colored patches. The rash can itch and lasts up to 3 days. As the rash clears, the affected skin might shed in very fine flakes. Other symptoms of rubella, which are more common in teens and adults. They include headache, loss of appetite, mild conjunctivitis, inflammation of the lining of the eyelids and eyeballs, a stuffy or runny nose, swollen lymph nodes in other parts of the body, and pain in swollen joints. Many people with rubella have few or no symptoms. The rubella rash usually lasts 3 days. Lymph nodes may be swollen for a week or more, and joint pain can last for more than 2 weeks. Children who have rubella usually recover within 1 week, but adults may take longer. Causes of rubella. Rubella is caused by a virus. It used to be called German measles, though it's not caused by the same virus that causes measles. Transmission of rubella. Rubella spreads when someone who is infected coughs or sneezes tiny germ-filled droplets into the air and onto surfaces. People who catch the virus are contagious for up to a week before and a week after the rash appears. Some people don't know they're infected because they don't have symptoms, but they can still pass the virus to others. How common is rubella? Rubella was common in the US before 1970, with epidemics breaking out every 6 to 9 years. The last US rubella epidemic was in 1964 to 1965. A rubella vaccine was developed in 1969. Since then, the disease has mostly been eliminated from the US. Rubella is still present in other parts of the world, and an infected person in another country can bring the disease here. However, Fewer than 10 cases of rubella are reported in the United States every year, and most of those cases originated outside the country. Nevertheless, anyone who is not vaccinated is at risk. It still spreads in Asia, Africa, and other parts of the world. Anyone can catch rubella if they're exposed to the virus and haven't been vaccinated. Pregnant women face serious risks because rubella can cause serious complications to the baby during pregnancy. Complications of rubella. The most serious of these could happen during pregnancy, when the virus can pass from mother to baby in the womb. The risk is highest during the first 3 months of pregnancy. Babies who are infected can have serious birth defects called congenital rubella syndrome, CRS. This is very rare in the United States, but a baby can get it if they travel to another country where the virus spreads. CRS is a group of health problems in a baby that can include heart defects, cataracts, deafness, delayed learning, liver and spleen damage, diabetes, thyroid problems. Some women who get rubella during pregnancy have a miscarriage. In other cases, the baby doesn't survive long after birth. It's best to get vaccinated against rubella before you get pregnant to protect your baby. You should wait at least 4 weeks after getting the vaccine to become pregnant. If you're already pregnant, you shouldn't get the vaccine. Rubella can also cause complications in women who aren't pregnant, and in men. Young girls and women who get it can develop sore joints, arthritis. This side effect usually goes away within 2 weeks, but a small number of women will have it long term. It rarely happens in men and children. In rare cases, rubella can cause more serious health problems, like brain infections or swelling and bleeding problems. Can tests determine if someone has rubella or is at risk? Blood testing is the only way to diagnose rubella with certainty. It can identify the virus, verify a past infection and establish whether the body contains enough rubella antibodies to prevent future infections. How is rubella treated? For the most part, rubella must run its course. No treatment or medication can bring healing faster. Bed rest is the best option for mild symptoms. You can use acetaminophen, such as Tylenol, and fluids for a fever. You should call a doctor if you have concerns about any symptoms in a child or an adult. Having rubella builds immunity against future infections. It is rare to get a second case of the disease. Is rubella contagious? Rubella is contagious, and passes from person to person through tiny drops of fluid from the nose and throat through sneezing and coughing. Someone also can get it by sharing food or drink with a person who's infected. People who have rubella are most contagious from 1 week before to 1 week after the rash appears. Someone who is infected but has no symptoms can still spread the virus. The virus also can pass through a pregnant woman's bloodstream to infect her unborn child. Babies born with congenital rubella syndrome are at risk for serious problems with their growth, thinking, heart and eyes, hearing, and liver, spleen, and bone marrow. They also can shed the virus in their urine, pee, and fluid from their nose and throat for a year or more, so can pass the virus to people who aren't immunized against it. Can rubella be prevented? The rubella vaccine protects people from the disease. Widespread immunization is the key to preventing the spread of the virus and protecting babies from the serious health problems of congenital rubella syndrome. Most rubella infections today are in young, non-immunized adults rather than in kids. In fact, experts say that about 10% of young adults are not vaccinated against rubella, which could be dangerous for any children they might have someday. MMR vaccine. What should you know about the measles, mumps, rubella, MMR, vaccine? The MMR vaccine protects against all 3 diseases. It contains weak, but live, strains of each virus that let the body build immunity against them. The vaccination is especially important for children and women of childbearing age. More than 90% of those who receive the vaccination never contract rubella. The Centers for Disease Control and Prevention, CDC, recommends vaccination in children when they are 12-15 months old. The second dose is at 4-6 years old, or at least 28 days after the first vaccination. Unvaccinated adolescents should receive 2 doses, at least 28 days apart. Adults born before 1957 and adults who have laboratory evidence of having had rubella or immunity to rubella do not need the vaccine. Scientists consider the following items to be evidence of immunity. Being born prior to 1957, because you likely did contract these diseases before vaccines were available. Having actual records of getting the MMR vaccine. Having laboratory evidence that you are immune or you did have the vaccine. Adults born during or after 1957 should receive at least one rubella vaccination if they have not done so previously. If you are in the healthcare field and you were born before 1957 and have no evidence of immunity, your doctor may consider giving the MMR vaccine. What are the side effects of the measles, mumps, rubella, MMR vaccine? Occasional side effects are mild and may include muscle aches and redness and or pain near the injection area. Fever, mild rash, temporary joint pain, true for about 25% of women who get the vaccine. Temporary cases of thrombocytopenia or low blood platelet count. This happens in about 1 of every 30,000 to 40,000 cases. Also, since vaccines are live but weakened strains of the virus, they may cause mild cases of rubella. Allergic reactions to the vaccine are more serious, but rare. You should get emergency help if they happen. Reactions include hives, swelling in the throat, tongue and/or lips, having a hard time breathing. Severe side effects like deafness and permanent brain damage are so rare that doctors are not sure if the vaccination causes them. No evidence exists that the MMR vaccine causes autism. Are there exceptions to those who should receive the rubella vaccine? Pregnant women should not receive the rubella vaccine. A woman should wait at least 4 weeks after vaccination before getting pregnant. Other people who should not get the vaccine include patients with impaired immune systems, including those with AIDS, leukemia and lymphoma. Patients with cancer who are undergoing drug or radiation therapy. Patients who are being treated with large doses of corticosteroids and other immunosuppressive medications. A woman who is breastfeeding can get the vaccine.